Thank you for selecting the Shiley Flex Adult Tracheostomy Tubes for your tracheostomy needs. This video will introduce you to sizing for the Shiley Flex. First, let's do a quick review of some key terms that we'll refer to during this video. The first term is cuff resting diameter, or CRD. The cuff resting diameter is the diameter of the cuff when the cuff is inflated to the recommended pressure of 25 to 30 centimeters of water. This measure is important to consider in order to obtain a proper tracheal wall seal to protect the lungs and enable oxygen delivery. The taper guard cuff has a unique shape when inflated outside of the trachea. However, when placed inside the trachea, the shape and contact will be very similar to that of traditional barrel-shaped cuffs. To determine the appropriate size tracheostomy tube, the most accurate way is to measure the tracheal opening and then select the proper size tube. However, this may not always be possible, and therefore the following information should be considered. This information is for reference only, and the clinician should make the determination for proper tracheostomy type and size that is best for the patient. Let's begin our discussion for the new adult Shiley Flex tracheostomy tubes. The older Shiley tracheostomy cuffs were designed to be at least 50% larger than the expected tracheal opening. The new Shiley Flex cuff is designed to be 15% larger than the expected tracheal opening. This difference is impactful in many ways. When the cuffs are deflated, you will notice that the Shiley Flex cuff is closer to the shaft and less bulky than the older Shiley products. This reduces insertion force. When the product is placed into the trachea, the older cuff had the ability to be inflated to a larger cuff resting diameter due to the amount of cuff material and the cuff's compliance or ability to stretch. The Shiley Flex taper-shaped cuff may not extend or overinflate to these larger diameters due to its design, and therefore size selection with the Shiley Flex tracheostomy tubes becomes far more important. For the new Shiley Flex, the historic product sizing may not work and may need to be revisited. To further understand the cuff differences, let's review how the Shiley cuffs respond during inflation within the tracheal opening. Here is a demonstration of the older high-volume, low-pressure cuff design of the 6DCT. You will see when the cuff inflates, it does so in a lateral, side-to-side motion. When contacting the walls, it continues to press in an outward motion as the material has nowhere else to go. Due to excess material, small folds will form along the tracheal wall. These small folds may create high pressure points and allow for fluid leakage. Here is a demonstration of the Shiley Flex with taper guard cuff. It demonstrates how this cuff design will inflate to the tracheal wall and then begin pushing air to the top and bottom of the cuff. The tapered shape will actually elongate, creating a tight seal with minimal small folds. This design and inflation dynamic helps reduce the overall pressure across the cuff and fluid leakage past the cuff. The tapered shape allows the air to disperse more evenly in all directions while maintaining a sealing band along the tracheal wall. In this study, the two tracheostomy cuffs are shown side by side for demonstration of how they're positioned within the tracheal opening. The taper guard cuff has a similar profile to the older Shiley product. However, the reduction in these small folds creates a better seal, reduces fluid leakage, and reduces lateral wall pressure. When observed outside of the trachea, this tapered shape may lead to confusion and questions for how it is positioned in the trachea. So, coming back to our sizing discussion, what should be considered to choose the correct size? The optimal way to measure the tracheal opening is with ultrasound, X-ray, or CT. Then select the proper cuff resting diameter and outer diameter of the product that best fits the patient. However, we recognize this may not always be possible. As with the older Shiley products, consider whether the patient is right for a standard continuous curve or if they need the Shiley XLT product. If the patient's BMI is greater than 30 kilograms per meter or the distance from the skin to the tracheal opening is greater than 4 centimeters, consider using an XLT. If the patient does not have the larger neck for an XLT and a continuous curve is selected, most women may use a size 6cn 75X, and most men a size 8cn 85X or a 9cn 90X. It may take a few placements and working with the product to determine the right practices for your patients. If your patient is experiencing cuff leaks, it's typically caused by one of two things. The product size may need to be larger and cuff resting diameter is not large enough for this patient, or they need XLT for the additional cannula length. This table compares the older Shiley tracheostomy products to the enhanced Shiley Flex products. You can see the optimum cuff resting diameters by size and optimal inflated pressure. The benefit of the taper guard cuff design is that a larger tracheostomy product can be selected for the patient. The combination of cuff shape and material compliance allows a larger size inner diameter to be selected. This minimizes small folds and reduces pressure along the tracheal wall. In a 2018 study, Jonathan Lindman stated that the outer diameter of the tube should be 75% of the size of the expected tracheal opening to optimize the airflow for the patient. With the tapered cuff, this allows a larger tracheostomy tube to be used without the additional pressure of the bulky cuffs. In conclusion, the Shiley Flex tracheostomy tubes have many patient-centric features. This includes the transparent flexible flange, integrated 15mm connector, and the low-volume, low-pressure taper guard cuff. This enhanced design allows for larger inner diameter options to reduce the work of breathing, create a better seal, and may be more comfortable for your patients. Internally, the taper guard cuff can reduce lateral wall pressure, which helps reduce the damage to the epithelial lining of the trachea and also surrounding tissue edema typically seen at the cuff location. The Shiley Flex tracheostomy tube family of products offers many enhanced features from more than 40 years of clinical experience. Should you have any questions about the Shiley Flex portfolio, please contact your Medtronic product specialist.